Hi, my name is Kirk Hamilton, your host of the Staying Healthy Today show. This is a show where we bring you key experts in the fields of nutrition, prevention, integrative, and lifestyle medicine. And we do that for the individual, society, and the world. And I will sometimes interview people live on the video podcast, or I will sometimes review a print interview that a researcher did, usually because they're across the world and felt more comfortable doing it that way. And today I am doing the latter. The title of the interview is Colon Cancer and Vitamin D Mechanisms in Prevention and Treatment, and came from an article published in Nutrients, April 15, 2025, entitled Vitamin D and Colorectal Cancer Prevention, Immunologic Mechanisms, Inflammatory Pathways, and Nutritional Implications. And the two researchers were from the Semmelweis University in Budapest, Hungary. One is a pulmonologist, Dr. Janos Varga, MD, and the other physician works in the Institute of Preventive Medicine at the same university in public health, Monika Fekete. And while it's a fairly long interview, and you can read it at the link underneath this um, video, but I just want to give some highlights and then my own personal kind of twist on it. And they get very technical, and so vitamin D is actually a hormone, and it's quite a remarkable nutrient. I think if I've been a vitamin C advocate for a long, long time, 40 plus years in integrated medicine, but I think vitamin D is probably the most important nutrient if I have to pick one, like to give to my grandchildren or something like that on a preventive basis. So they start off by discussing why it's important in cancer prevention, treatment, and then prevention of recurrence. And the technical things that vitamin D does is it enhances cell differentiation and inhibits cellular proliferation. So, in other words, it enhances normal cell growth and inhibits the proliferation of the excessive cell division that happens in cancer. It promotes apoptosis, which is the timing or cell death of the cancer cell. And then it modulates inflammatory pathways. So it turns off or suppresses pro-inflammatory pathways, and then it enhances uh, anti-inflammatory pathways. And then it affects the immune system. It enhances tumor fighting cytotoxic T cells, and then it suppresses pro-tumor promoting T cells as well. So the last thing it does, which people don't recognize it for, is that it has an effect on the microbiome, the gut. The gut comes up again. And vitamin D has a positive influence on the microbiome that may be important in the prevention of colorectal cancer. So the question comes up, and uh, I do vitamin D levels, done thousands, and do them on people several times a year. And so the question is, what is a dose that you want to achieve just for vitamin D adequacy, and then for cancer prevention or chronic disease prevention? But then, is there an optimal dose if you have cancer, um, or you're trying to treat cancer and have vitamin D as part of the treatment? So that's a debate, and usually the public health individuals like these people are going to be more conservative. And there's always been this thing and a kind of a fear about the toxicity of vitamin D. I mean, I've heard it for many, many, many years. Vitamin D, fat soluble vitamin, irreversible toxicity, and truthfully, I've never seen it, even though I've gotten people's levels very high. So I want to share with you what these authors, these public health officials, say, and the goal is, I'm going to just talk in one unit, but there's two units that vitamin D is shared in, is nanograms per ml, or ng/ml, or nanomoles slash liter. And so the more common way, unit that we see is nanogram per ml, and then that's the one I'm going to use. So the basic cutoff on most laboratory tests are 30 nanograms per ml. That's the cutoff for deficiency versus you have enough. And most of the doctors that I would say that I see in the traditional realm just shoot for that goal if they are paying attention to vitamin D at all, which I see many people don't. So that's kind of the minimum that you want to go for. And so whenever you get a vitamin D level, you should definitely make sure you know what level you're shooting for. And then you can see what amount you're taking and either tweak it up or tweak it down, but usually it's tweak it up. So some people, these authors say that they say an optimal level is between 36 to 40 nanograms per ml. In my experience, that could be anywhere from 2,000 to 5,000 IU per day. Um, and the authors then do what many public health professionals do is that they're conservative. And so they have a I asked for like optimal range or potentially harmful range and minimal range. So minimum recommendations are greater than 30 nanograms per ml. Optimal might be between 36 and 40 nanogram per ml. That's for cancer prevention and also maybe for prevention of chronic diseases as well. And then potentially harmful is 100 nanograms per ml. Well, there's a big range there between 40 nanograms per ml, the upper optimal range, and then the toxicity range of greater than 100 nanograms per ml. And I can tell you, I've gotten, not on purpose, but a few patients above 100, between 100 and I think 115 was the most I've ever done, maybe 120. And it wasn't on purpose, but sometimes people think they're taking 1,000 unit vitamin D and they're taking a 10,000 or whatever. But here's where the clinician and maybe public health officials, they kind of separate. I mean, I have never seen anybody have side effects. Now, I don't keep people at that dose. Okay. But if I find out on screening it's high, then we cut their dose down. And then if it doesn't make sense, like for example, if you had 100 over 100 and you're taking, 1,000 IU of vitamin D, there's something that's not right. You're either getting it somewhere stashed in another supplement, um, or you're mistaken. I've had people mistaken 10,000 for 1,000, and they thought they were taking that. And I had one patient, I think, that was taking 40,000 units a day and thought it was 4,000. And so even with that, those mistakes, and even with some people getting above 100 uh, nanograms per ml, I've never seen a side effect. So that doesn't mean there can't be one. That means I just haven't seen it. I don't think it's as bad as it's meant out to be that, this is some kind of irreversible toxicity. And so there's a wide range, it's 40 to 100. And so I go on to chat with them about this and say my own personal experiences and they said maybe 30 to 50 nanograms per ml is optimal in cancer situations and it's safe. And they happen to note a study called the Sunshine study where the authors were loaded with 8,000 IU per day of vitamin D for 2 weeks. And then they went to a maintenance dose of 4,000 IU per day, and it helped with the prognosis of their cancer. So that's one of the the largest probably trial that's been done to show a higher level. I routinely, and I'll just tell you, again, these professionals, um, you know, 2,000 I use a recommendation to get between 30 and 40, according to these authors and the research. I routinely give 5 or 10,000 to patients, and I always follow up though. It's not like I give 5 or 10,000 and I say don't see you for a year. And I can tell you that doesn't always come up. Everybody's a little different, body mass size, fat stores, etc. So I don't have any problem, like for example, a cold or during COVID or something like that. I'll do 20,000 IU for a week in a patient. Some people will do way more than that, some professionals, but I say do 20,000 IU for a week and then cut it down to 10,000 IU, and then maybe I'll check it. Now, as far as cancer, I've tried to keep mine. I had colon cancer, and I've tried since then tried to keep mine between 50 and 75 nanograms per ml. And usually I'm taking 10,000 units a day, but it ends up being 5 or 7 days a week. And but I've never had a problem going higher than that. And again, every once in a while I'll see a patient and they'll sneak up to that 100 range, and you'll find out that they might be getting it from two sources versus one source, and then you just stop it, and it goes down after a couple of weeks, and then you start back up again. But rarely do I stay at 2 to 4,000 IU. 5,000 IU is generally my minimum. So in this article, they talk cautiously, as they should, and they go by the studies. But yeah, with regards to cancer, there's no question that it's involved in and beneficial for those in prevention. And personally, I would try and get above 50 versus stay between 30 and 40. I'd try and get between 50 and 75 nanograms per ml. And with treatment, some people will go higher. And I think that just needs to be explored. And you can follow people. So if somebody wanted to go higher, and let's say 10,000 or 15,000 or even 20,000, you can follow them and see, because vitamin D levels are easy to obtain and they're relatively cheap. And, a lot of insurance pays for them. So you could check in a month. So I would probably push the dose in cancer if it was me, which I did. But I think if you're a layperson, 5 or 10,000, but ask your physician, just measure it. And if they don't want to measure it because they, for whatever reason, then there's lots of different ways of the public. You can just Google how to, labs that will allow you to evaluate your own vitamin D. But it's very important in colorectal cancer prevention, treatment, and recurrence. I think you'll like the author's detail. They're all obviously very, very, very credible. And vitamin D is probably one of the most important for cancer. And in the future, I'd like to interview some people who maybe are using higher doses in clinical studies or just as a clinician for cancer treatment. But until then, my name is Kirk Hamilton. This is the Staying Healthy Today show. And again, there'll be a link to the interview below this video. And until next time, stay and be well.